Introducing the Family Partner Practice Profile, a joint project of the Massachusetts Department of Mental Health and MassHealth, April 2025. In this overview of the Family Partner Practice Profile, we will talk about what a practice profile is, why we developed a Family Partner Practice Profile, what a family partner is, how the practice profile was developed and the intended audiences, scope of the practice profile, how to use the practice profile content, and where to find more information about the practice profile. What is a practice profile? The University of North Carolina National Implementation Research Network defines a practice profile as a tool to help programs put the core elements of a service or practice in place. It breaks down large concepts, such as engagement, into separate skills and activities that can be taught, learned, and observed. The URL for the research network is shown. Why a family partner practice profile? As more family partners join systems of care for youth and families, this practice profile is intended to provide clarity about their role and to deepen understanding of their important work. This is accomplished by describing the main practices that family partners use in their work with caregivers. Each practice is broken down into the skills and activities that are required to effectively implement the practice. That is, what are they saying and doing when delivering family partner services? What is a family partner? A family partner is a person who has the lived experience of raising and parenting a child with significant mental health needs and has been trained to provide a range of supports to caregivers of youth with similar needs, and also has extensive knowledge and a deep understanding of behavioral health service systems for youth, gained through their own experience navigating service systems for their child and training and knowledge gained on the job. Depending on the setting or contract, there may be additional criteria to work as a family partner, such as education or years of experience. In Massachusetts, people who are parenting a child with a mental health condition receive support from others who share this life experience. The professionals who provide this support are referred to by multiple names: family partner, parent peer professional, parent peer specialist or worker, family support specialist, parent coordinator, family navigator, and family service leader. In this practice profile, the term family partner is used to refer to all of these roles. The shared life experience or peer experience between family partner and caregiver creates the foundation for a unique and powerful relationship that can have far-reaching positive impact on outcomes for youth and families. How the Family Partner Practice Profile was developed. The practice profile was developed through a collaboration between the Massachusetts Department of Mental Health, DMH, the MassHealth Office of Accountable Care and Behavioral Health, and stakeholders that included family partner supervisors and trainers, parents and caregivers, leaders and agencies that employ family partners, and DMH and MassHealth staff. At a series of meetings held between January and April 2024, these stakeholders provided input, guidance, and feedback on the development of the practice profile. In May 2024, a survey was sent out to a broader group of stakeholders statewide to gain further insight on the content and readability of the practice profile. The intended audiences for the Family Partner Practice Profile include family partners and senior family partners supervisors and program managers, leaders in organizations that employ family partners, trainers of family partners, and organizations that serve caregivers who use family partner services. Scope of the Family Partner Practice Profile. The practice profile describes the best or ideal practice for family partners, that is, what a family partner should aspire to in their work with caregivers and families. It focuses on best practices for a family partner's direct work with caregivers in any context or setting. Other activities a family partner may perform, such as leading support groups or providing community education and training, are not described here. The practice profile describes family partners' work in behavioral health settings. However, it may be useful beyond our target audiences, such as family partners working in medical settings, as there are commonalities across settings and systems of care. How to use this practice profile. The practice profile can be used to guide a family partner's work with caregivers and families. It can also be used to guide family partners' supervision and ongoing training and coaching for family partners and family partner supervisors. It can be used to inform policy and procedure decisions in organizations that employ family partners, such as personnel policies, and during staff recruitment and the hiring process to explain the job. This practice profile can also be used by leaders to communicate the vision and goals of the family partner service within their organization and to help staff understand the service and its value. It can also be used to support staff in following practice standards, such as those described in this practice profile, and to support effective implementation of the service through collaboration with other service providers and systems. The practice profile can also be used to educate systems of care about the value, role, and work of family partners. The practice profile is intended to complement an organization's existing training and supervision materials and other resources relating to family partner services. Practice profile content. The Family Partner Practice Profile identifies and describes the basic functions or core elements of the direct work that a family partner does when working with a caregiver. There are 11 core elements. Each core element begins with an overview, followed by a set of skills to put the core element into practice. Each skill includes a list of activities to make the encounter successful. Although the core elements are described separately, they overlap and often occur at the same time. They almost never happen only once, nor should they. The content of the practice profile is illustrated here with an excerpt from the Using Lived Experience core element. The 11 core elements of family partner practice include using lived experience, empowering families, conflict engagement, practicing cultural relevance, collaborative goal planning, transition planning, engaging families, safety planning, collaborating with external providers, learning about the family's parenting culture, and educating caregivers.